There's so much confusing and conflicting information out there around pregnancy and birth, and none of it comes from the people that are actually in the room. We are Sarah and Catherine, two Canadian labor and delivery nurses with over 4,500 births under our belts.
What if the nurse holding your hand during labor could also answer every question you were too nervous to ask your doctor? Welcome back to 4,500 Births Later. We are here with Fiona Mattatall, our obstetrician and friend. For the listeners out there, if we can get down to some of these specific examples that we could address right here and now. Again, we have an obstetrician here who has how many years experience did you say?
Well, 21 years as staff.
21 years
17 years of university before that.
One of them was regarding a rupture of membranes, but a doula had stated that when a patient's water breaks, that there is only a 1 to 2% chance of forming an infection to allow the rupture of membranes to go on for hours, days, etc. Response to that?
Oh, I have a few responses to that. For starters, can I just make a comment about doulas?
Please.
To start?
Please.
Doulas are and can be valuable members of a team that a person puts together for their journey, in birth and postpartum. But many doulas do a great job of the psychosocial support of a person in that journey. And I certainly saw in my training in Halifax, the doulas there were very different than the doulas here. In Halifax, doulas were a volunteer organization, and they were actually assigned to people who came in labor without a support person. So they were that one-on-one person for somebody who didn't have like a partner or a friend or a parent or a sister or brother to be there as support. So they were very, very helpful for people who just did not have that other person in the room with them. I've seen it as quite a different model in Calgary, and there are some volunteer doulas out there who do still have that role, but what I see more is we have more doulas who are there for somebody who already actually has quite a bit of support, which is great if you can, afford to pay for that extra person. That's really nice. But what's important for people to know is that doulas come with training in psychosocial support of people. They do not have a medical training or background necessarily. And so doulas are not supposed to be giving medical advice to their clients. And if a doula who is someone who has not had training as a nurse or midwife or physician specifically, then they should not be eliciting advice like was stated. And that's not their role, and it's definitely overstepping their bounds. So in terms of, quoting that, when someone's water breaks, that the risk of infection is 1 to 2%, I'm not sure where that statistic comes from, but that does not sound like an accurate statistic for me. To quote one, I can't actually even quote one off the top of my head. I would want to go look at the evidence in the medical literature to see what the number is. I suspect, based on my years of experience, that it's higher than 1 to 2%. But the other piece of it is, it's taking it to the next level. Like, okay, even if it is as low as 1 to 2%, what are the implications of that 1 to 2%? And the implications are, if there is an infection that develops in the course of labor, the infection is caused usually by a number of different bacteria. The vagina has hundreds of different strains of bacteria, most of which are really healthy to be in there. And as a gynecologist, I talk to patients all the time about it's a self-cleaning oven. Like, you don't need to do anything special with it. Most of what's in there is really healthy for us. And most of what's there is actually healthy for a baby to be exposed to. But there are some bad players, just like politicians. There's bad players. And so some of those bad players can cause an infection, and we don't always know exactly which one it is. So we have to actually start some pretty big antibiotics if there is an infection starting. And the infection is not just to the mom, because that infection is inside the uterus. It can also spread to the newborn. And newborns don't have the best immune systems when they come into the world. It does develop and continues to improve over the first few months of life. So sometimes that means even giving a newborn baby an intravenous and antibiotics after. So even if it is as low as 1 to 2%, the implications on the newborn's health and the health of that mom are big. And some of the sickest patients I've ever looked after in my career are women who've experienced an infection in the course of having a baby. As when we are pregnant, our immune systems are not at their best, so we're more susceptible to many infections, including ones inside the uterus. And the uterus is a very vascular area when you're having a baby because there's blood flow going in to that pregnancy. And so when there's an infection there, it's very easy for bacteria to gain access into our bloodstream because of how the uterus is. And so I don't love that comment by the doula. And I wonder if there might have been something behind it in trying to discourage a woman from intervention.
I think that's what it was.
Yeah.
Just wait until the water has broken. So now she's going to
Right.
kick into labor. Just let her go into labor automatically.
Yeah. And one thing I've heard patients tell me is that my doula said that if my water breaks, I should stay home. And I really quickly counter that and say, no, when your water breaks, that's actually a big change for both you and your baby. So you should come into hospital so we can just see how you're both doing, assess how everything is, and then have a discussion about, well, okay, what is the next step? Do you stay in hospital at that point or do you go home? But even going home, we are now aware that something big has changed in your pregnancy and you're probably getting close to having the baby. So we want you on our radar for our unit. Like we want to know that, okay, someone's out there whose water's broken. We want to make sure we have space for you, make sure that, you know when to come back, signs to watch for. So I hear that quite often that they've been misinformed that they shouldn't come into hospital when their water's broken, when we very much want to know that and then decide where to go from there. But it doesn't automatically mean that you stay. It doesn't automatically mean that you ignore it either. It's an important little timeline and point in having a baby.
Thank you for clearing that up.
As you were talking about the bacteria
Yeah.
in the vagina, I was thinking about in BC, they were doing a study on vaginal seeding.
Mm-hmm.
Are you familiar?
Oh, very
with that?
familiar. Yeah.
Okay. So maybe we could talk about that a little bit.
So vaginal seeding's fascinating. And just to give you a bit of background, going way back to when I was in grad school doing that research, I ended up tagging along to a conference, a microbiology conference, and they were talking about vaginal microbiome. And this was early days, because this would have been late 90s. And so there's been a lot of curiosity and research on the bacteria that live in and around our vaginas. There's been some interesting work looking at the exposure of a newborn to those microbes and how does that impact our long-term health. And it's important when you look at those studies. And the first big one that came out was in fact out of Edmonton, and it kind of rocked everybody's world with how they looked at babies born by cesarean section and babies born vaginally, and then looking at their long-term health outcomes, and then starting to ask that question about what role do the bacteria play. So that study came out, it must be about 15 years ago now, and there's been some work since then. I was at a conference in the UK just before the pandemic hit, and there was one of the world experts in vaginal bacteria was giving a talk. So of course I went to that talk. I was like, oh, this is really cool. And now this is now a few years old because this was just before the pandemic, but his take, and he is the world expert in vaginal microbiome, is that we have such a rudimentary understanding of what's going on with the bacteria in the vagina that it's too early to know what is the right thing to do. And so vaginal seeding, the concept is that if you are having a baby and the baby is not going to be exposed to the microbiome of the vagina, so meaning having a cesarean section without labor, and from my own personal experience, that was my second pregnancy, was going to be that. So I certainly thought through a lot of this because I was like, okay, my youngest is not going to be exposed to those bacteria. People are starting to talk about seeding. So do you try to gather up some of those bacteria and introduce it to your newborn baby who's not coming through your vagina and being exposed to them? And I've had a number of patients make that request over the years. Early on, I did assist 2 patients in vaginal seeding. And then as we were starting to see a bit more information come out, Health Canada reviewed the process. And so they did a very robust review of the medical research at the time. And they, in their wisdom, said, we do not think this is actually safe. It might be, but we don't have enough information yet. So the recommendation from them was to not promote it. So their message to us as physicians was, this is not something you should actively be doing. Now, if a patient chooses to do that, that is absolutely their choice to do. But they were not wanting us to say it's something you should do, something you can do, but not something you should do, if that makes sense.
Right.
It's a subtle difference. So that's when I stopped, even though, full disclosure, I had 2 patients who I did help facilitate this. And we are still at that point where it's too early to tell if it would make a difference. It would be nice to have that answer, but all good information takes time. So if you were to ask me, what did I do when I had my planned cesarean section? In the end, I decided not to do vaginal seeding, and a lot of the information had come out through Health Canada at the time. And one thing I chat with patients about who do ask about it is that I say, well, I can't say you should do it, but you can. The other thing that was very interesting is if you look at the studies on the impact of our bacteria on our newborns, the research, it's kind of gross, but it's really interesting, is what they do is they look to see what bacteria do newborns carry. And the most rich place to find where babies have bacteria is in their poop. Babies poop all the time, as we all know. And so what the researchers do is they look at stool samples from newborn babies and they watch them over time to see what number of bacteria do they have and how many different kinds of species of bacteria do they have in their poop. And what's really interesting is if you were to take 2 newborn babies, one who came out vaginally and one who came out by cesarean section, and you look at their poop for the first few weeks of life, you can tell who came which way.
Oh,
Because the babies born vaginally do have a more diverse microbiome. They've got more different kinds of bacteria. Whereas the babies who are born by cesarean section usually only have 2 or 3 species of bacteria. And it's usually the ones that we see on skin, not the ones we usually see in vaginas. But if babies are breastfed, between 3 and 6 months, you can't tell the difference in who came out which way. So there's something about breast milk that sort of corrects that difference in what bacteria they have growing in them. And I think that's so interesting.
That really is.
I
Yeah.
don't think anybody understands why yet. Like I said, there's a lot of work to be done in this space. And I love that there's microbiologists who are into this. We actually have a vaginal microbiome researcher in Calgary. And so there's work being done. And it's unfortunately maybe not an answer for someone having a baby this year, but I'm hoping in time that we will have better information on that microbiome, because some people have a baby born without exposure to their vaginas. And my second child was one of those. And that was the safest thing for both her and me for that birth. Very different from my first pregnancy and my first birth. They could not have been more different. But I've got 2 healthy, lovely kids, but 2 very different experiences, both very humbling experiences as a mom, but also as an obstetrician, and some interesting decisions to make, like around vaginal seeding. It's an interesting discussion, but not ready for prime time yet.
Can you just describe exactly what they do?
Well, I've heard of different things that people will do, but you basically need to get some of the secretions that are in the vagina that are rich in bacteria to the baby. And most of the thinking is, well, when a baby comes through a vagina, they're coming head first, like their whole body gets covered in bacteria. But the ones that end up coming inside and like seeding their intestinal tract and their gut probably go in through their mouth and nose. So most of the techniques I've seen are either putting like a tampon or a swab or something in the vagina to collect some of that fluid and bacteria and then put it around the baby's face. But then you can start to go down this deep hole of, well, what, if you use a tampon, are there things in the tampon that maybe are not safe for baby, or maybe there's like antibacterial properties. So it might actually not work. One of the reasons that Health Canada has cautioned against it is one of the bad bacteria, which is group B strep, and which is a bacteria that here in Calgary, we offer that test to every pregnant person around 35 or 36 weeks. We check for this bacteria in the vagina and right close to the rectum. And if somebody does carry that bacteria, that is one that can cause quite a significant infection in the newborn. So if somebody had group B strep and then you introduced it to your newborn with vaginal seeding, you could actually cause harm to that newborn baby. And in some places, if a person is planning a cesarean section and not planning a vaginal birth, they might not do the group B strep swab. So somebody could be vaginal seeding group B strep to their newborn and cause a significant infection. There's other microbes like herpes virus that could be spread this way too. So that, I think, is also why Health Canada says we don't have definite benefit to this, and there's maybe some risks for some people. So that's why they are saying don't recommend right now.
Okay, thank you.
Doesn't the microbiome change over time?
In pregnancy, we know microbiome changes with hormonal changes. There's even, and this kind of blows me away, because we always thought of the fetus in this sterile sac, but there is evidence that some microbes might actually start seeding that fetus before they're born. It's not like well done, like deep research yet, but there is some interesting stuff going on there.
Wow.
And so, yeah, you think of when we're born, our microbiome is going to change throughout our lives. And we are only at the very early stages of understanding the impact that has. And there's some really cool work looking at autoimmune conditions and conditions like Crohn's and colitis, even some mental health impacts from microbiome. So the bacteria that live in us have a way bigger impact on our health than we ever really appreciated.
Mm-hmm.
And I think it's going to be fascinating to see where this rolls out. But then coming back to, that first breath we take when we're born, I've had patients say, well, should all of this be swaying me in how I think my labor should go, or should I be having that cesarean section? Should I be trying for a vaginal birth? My answer to them is we just don't know. We don't know more than we know, really. And it's quite humbling. The more you learn about things, the more you realize we really are just at the beginning understanding of things. And I say, just make the best decision on the information you have. And this is not a piece of information that I think should be forefront in your mind in driving your decision of how to have your baby or where to have your baby, any of that.
Mm-hmm.
But it's really interesting.
If you have any questions about what you heard today, please reach out. Sarah and I would love to hear from you. Email us at birthslater@yahoo.com. That's birthslater@yahoo.com. We are here to support you every step of the way. And now for the legal language. This podcast is solely for educational and entertainment purposes. This podcast is not intended as a substitute for professional advice from qualified individuals involved in your prenatal, labor, and postnatal care. Every pregnancy and birth is different, So always talk to your healthcare provider about what's right for you.